This is sterile gauze. For each sterile bag, you have to make sure it's all sterile. There is no hole, knot, and you have to make sure it's sterile and the expired date. So it's sterile. There is a correct way for opening any sterile bag. The black mark here means it will be open from here. So we are going to open that. We are not going to tear it. Just observe that I am touching only the outer surface that it's allowed to be touched. I will not touch anything from inside. Now we are going to pour the betadine to the sterile bowl, because it's sterile and this one is not sterile, so you have to keep a distance. So just from a distance you will pour some betadine. As we mentioned before, this is sterile gloves, so the black mark here will be the opening, and I already checked the expire date. If you check it here, it's written fill down to open. So this one, like we mentioned, it's touchable, this one, so you are going to open it from here. Now we are going to open this one. This is right and this is left. This one that we can touch. See this mark? This one is considered unsterile. All the inside is considered sterile. Now we are going to do open gloving, and this is the way for the dressing. Now I'm going to touch this one, because this area that I'm going to be touch the skin, so you can touch it. Here, thumb with thumb, I'm going to put my hand and fill it down. I didn't touch anything that's not supposed to be touched. Now this area is going to touch the skin, and this is sterile, so I'm not going to touch it. I'm going for the sterile part. Now this is sterile and this is sterile, so you can adjust your glove. Do interlock to make sure it's good. You have two options. You could use your hand with sterile gloves directly, or better way to use the instrument. This is to use forceps. So I'm going to put the sterile gauze to the bowl. Observing that the bowl also sterile, so I can touch this one. Take it to the patients. Now we are going to do the dressing, observing that we already put the rubber sheet in under the patient, so any discharge will going to be full. It's not going to be with the pad and do the messy part. Okay, we are going to do the dressing. We are going to do the dressing from up to down. According to the aseptic technique, we must start from the most clean to less clean. Okay, so we are going to do the dressing from up to down, from far to near, and this is the principles of the dressing. While I'm doing the dressing, I'm observing that there is a little bit discharge coming from the wound, so that means that the wound is infected, so we have to do the irrigations. We'll take sterile dressing make it as a roll. And there is two ways to do the irrigations. You will do like this, pushing from the both side so that the discharge will come, and observe it by the dressing. This is one way. The other way, you will do the rolling and go from up to down. Just apply the pressure so the discharge will come. Now we are observing there is a lot of discharge and there is a separations of the suture line, and if you're going to observe there is a separation in the suture line, we are going to do irrigations by normal saline. We have syringe full with normal saline. You're just going to get it from the bottle, and we have sterile kidney basin. You have to put the sterile kidney basin under the patients, and you will put the tip without needle inside the sutures that is going to be removed, and push it. As we observing, we put the patient on the side, so all the drainage will going to come back to the kidney basin with gravity, and if it's not going back, you have to do squeezing, so all the discharge will going to the kidney basin. Then you have to observe the discharge coming from the wound for the COCA also, and to record it and document it, and the amount of the irrigation must be the same amount that we already push it in the wound. Now we change the gloves again and do hand washing. Put another sterile gloves for the dressing. What is the most clean? Which line is the most clean? Of course, it's the suture line. If it's all clean, closed incisions. So I will start from up. Do a little bit pressures. Continue with the suture line to the end, and discard this one in the red bag. We are going to do this again. Please observing here. I'm do the soaking with betadine and squeezing it at the tip of the bowl, so it will not make a messy from the patients. Again, we'll do the suture line, applying pressures and till down. We're going to discard this one and take another. Do the squeezing and apply it for 3 times or as it needed. So if the wound, if you see it's clean, it's okay. If you see that the wound is need more cleaning, please apply more. Now we finish the center line, that's the suture line. We are going to do the far side and the near side. There is 2 ways now. It's for your options. Or you're going to longitudinal, please do not cross the suture line. So you will going the first far line and discard it. استنى جدا.